What's up, GERO 200? Hey, it's Monday morning, the 29th of May, 2023, and I'm doing the second assignment for this week. Just to give you a heads up, it's time to kind of start wrapping your head around doing your first short writing assignment right here. The critical thinking assignment 1 is how you access the instructions. You just click right here. All right. Everything is laid out pretty clearly. We have to, of course, have the learning objectives, but right here it's the description assignment. Okay, so we want you to collect data from the U.S. and 2 different countries. One of the country has to be a developing country. You know, we're pretty developed as the U.S. Okay, so what you do is you scroll down here, and this is the last list of developing countries. Choose one, that you have a relationship with. It makes it a lot more fun. All right. You could do 2 developing countries. It doesn't really matter, but at least one has to be developing. And the U.S. Okay. This is the how-to video that I did for last semester. I'm just going to leave this right in there. Okay. It's a pretty nice description of what's going on. That's how I'd go about learning how to do it. In the assignment, you'll see here that we're asking you to look up information on 2 different topics. Okay. So we're going to look at life expectancy, as we see right here, okay, and then the other topic is right in here, and you will go investigate this one right here, okay. We can just check this out right here, and this is called the life expectancy, and this is the dependency of age groups, okay. Coming right here, and there we go. All right. So this is just the change in the working age in elderly populations. Okay, so we see a lot more older people here, far fewer working age, and then down here the youngsters. Okay, so this is how you're going to go about this. Okay, and you're going to, again, select a couple different countries. Okay, and that's kind of what we want you to do. Alrighty, so you can change your country right here by clicking right there, and then you go in. Okay. So this right now has, Afghanistan, and if you changed your country and looked at, for example, Argentina, you'd get a whole different ballgame. Okay, alrighty. You just kind of read through this right here, and you see what's going on here. And these are the reality as measured. This over here is the projections. Okay, all right. So there's the last chart. Okay, the first chart takes you to a different site in terms of this, and this is life expectancy. You go right here. Okay, and what you need to do is hunt around a little bit and find it. Lots of really cool charts to look at. But this is the life expectancy table. That's really neat. Okay, so you change your regions right there. We see we had in the previous one, we had Africa, America, Asia. Those were continents. We can get rid of the world if you wish. You follow the instructions. We can look at Luxembourg, Lithuania, and Libya. Okay, and we come up here, and then that's what you have projected right here. Okay, in terms of life expectancy. All right, that's that. Okay, do follow the rubric. Okay, so you come down here, and it tells you exactly what it is we're looking at. Data collection for 3 countries, data collected for life expectancy, and then the makeup of the dependents, the elderly and the young and the working age. Trends over 50 years of age. So over 50 years of analysis. So how have things changed? Okay, and why the countries differ based on where you see them in terms of whether or not they're developed or not developed. Okay, so I did an overview. Check out that video as well. Let's go straight into week 2. Okay, we're going to go into assignment 5. Okay, so we're going to scroll down here. It's 4. This is just a reminder to get that stuff done by June 5th. This is assignment 5. Okay, so we're going to click this, and this is a big one. Okay, this is basically an epidemic in our country, and it's diabetes. An epidemic in all developed countries, as we'll see. We'll look at some of the data. It's kind of mind-blowing. Okay, first thing we need to do is open the quiz. Okay, like I said, and you can open the quiz in a separate browser. I'm going to scroll on all the way down here. There it is. So you can open this in a separate browser or in this browser, but twice. Check out the questions, make sure you're familiar with it, and then go through the material. That's the way we roll here, okay? So we're going to start with just the ABCs of diabetes. It's a real fun, easy slide deck. And then we're going to get into just some numbers about how things look worldwide, how this is a global issue, and how it's becoming more and more prominent in the undeveloped countries. Okay, and look at some of the key numbers. And so we encourage you to go and check out the US of A. And then we're going to get a little bit into the biology down here, consequences of diabetes, the numbers, and what they all mean. So let's just do diabetes 101. Okay, so I'm going to click on that and bring up our PDF file right here. Okay, so yeah, so this is put together by the American Diabetes Association. It's real simple, okay, and I'll give you some of the details. Some of what they say needs a little more clarity, okay. So we talk about one, of course. What does diabetes stem from? It really does stem from our diet and how we handle food, and then also a lot of genetics. We're going to differentiate between the juvenile onset, which is really just really bad luck, and that's where most people believe it's a virus. It gets in there and destroys your ability to produce insulin. And so this is insulin right here. Your pancreas is an organ that senses the amount of glucose, the G, that goes into your blood after you've had a candy bar, after you've had a meal, and then it releases insulin, and then the insulin will go everywhere throughout your body along with the glucose. The insulin fits like a key going into the lock. It activates a receptor in your liver, a receptor in your muscle cell, or a receptor in your fat cells, and it basically opens the door and allows the cell to vacuum up the glucose and then store it for later. Okay, so that's how that works. Alrighty, now we can look at consequences, okay, that happen, okay. You can have too little insulin, okay. You can have a situation where your cells are not able to read the insulin, so the receptors become really insensitive. This is the age-related one. It is modifiable by life choices like exercise and stress and diet, so it's a way to keep it in check. But if your cells are not able to capture the glucose, then the liver they send out signals to the liver and say, I'm not seeing the glucose, can you deliver more? So now you have tons and tons and tons of glucose in your blood, not going anywhere, and going back to the reading from the previous assignment. High levels of blood glucose cause this glycation end product. It's like a candy coating that causes severe inflammation. All right. So what happens when you have all the blood glucose and it's not being sucked away and packaged away into your liver or packaged into muscle or into fat cells? The glucose goes down. Your blood, goes along with carrying the glucose, goes down into your kidneys. Your kidneys then filter it out, and you pee it all out. So you pee out the glucose. But you know what? Have you ever taken a spoonful of sugar and put it into water? You stir it up. Guess what? It's all surrounded by water. So everywhere the glucose goes, it takes water with it. So you end up having increased urination, abnormal levels of peeing, and that takes all the water out of the body. So you're really, 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 really thirsty. Okay, these changes in blood flow, along with inflammation, okay, can cause blurry vision. You don't have glucose being packaged because the insulin's not working, okay, or you don't have enough insulin, and you start feeling really, really fatigued. Okay, your brain, your body, everything is crying out, "Where's my glucose?" Okay. All these problems that are happening in blood vessels too can really hurt you in terms of wound healing and cuts. You have immune dysfunction, so you have lots and lots of infections. So when the diabetes gets really bad, you actually will begin to shed weight, okay, because you're not able to package the glucose, nausea, and vomiting. All right, cool. Long-term problems. Everywhere there's a blood vessel, okay, especially important blood vessels, then if the blood vessels are getting damaged by the glycation and the inflammation, they stop working right, and you can get diabetic retinopathy, a blindness. You can get diabetic nephropathy. Okay, that's kidney disease. People lose their kidneys. I know a couple of people that have lost their kidney because of the consequences of high glucose causing inflammation and infection in the kidneys. Same thing happens down everywhere the blood flows. Your nerves need the goodies, okay? The blood flow gets cut off, you get nerve damage. This will happen, especially down in your feet and in your legs. It can then cause infections that result in amputations, okay? The other big ones are heart attack and stroke, okay? Everywhere there's a blood vessel, it can go bad because of what diabetes does to your blood vessels, okay? Awesome. All right, so 2 types of diabetes. This is the one that is incredibly rare, type 1 diabetes, about 1 in 200,000 people. I may have that wrong. Let's just see what the numbers are here. All right. 1 in 20 people, okay, get type 1 diabetes. That's a big difference. I don't know why I was thinking 1 in 200,000. And it's where you can't make insulin because your immune system has attacked the pancreas, okay? Thought to be maybe from a viral infection, and this is juvenile onset, all right? So these are insulin dependent, and your pancreas is gone, and you have to do daily insulin injections, okay? You have a sensor on a patch on your skin where you're always sampling your blood glucose levels. Used to be you had to do a pinprick, but now there's a sensor on the skin, okay? Type 2, this is the adult onset, okay? The insulin in the initial phases is being secreted fine, but your receptors don't recognize it. They become insulin resistant because of the high level of inflammation affects how these receptors work, and also because when you're obese, you secrete a bunch of hormones that also reduces how the receptors work. Then the pancreas goes into overdrive and starts pumping out twice as much insulin. Still doesn't work, and that all that growth in the pancreas causes it to fail, and then they become insulin dependent as well later on in life. Okay. Same old symptoms, like we already went through this. Okay. You have to be very careful though in a type 1 diabetic where you have no insulin. Okay. It means you can't use any of your glucose, okay? So then you go into ketosis, which is a fad. We do a lot. If you do fasting, you burn fat, okay? And part of burning the fat is then you make these things called ketone bodies that the brain uses and your heart and your skeletal muscle use, okay? But long term, it really changes the pH of your blood. It becomes super acidic. And this can be an emergency. The acidity in your blood can cause all these problems that we see right here. Okay. All right. Let's go now. Yeah. Okay. So how do you manage type 1 diabetics? You have a glucose monitoring system. Like I said, used to be a pinprick. You would drop the blood onto the sensor. It would tell you what your blood glucose levels are at that point in time. There's now a more modern technique that it's a patch put on the skin, and the blood glucose affects the conduction of surface electricity on the skin. And then the other thing is you got to really watch your activity, your food choices, educate the patient, and make sure they have availability to insulin. Okay, so this is the severe weight loss because of the glucose not getting into a child. It's an old picture. Before they were discovered that they had diabetes, and once it was discovered, then you inject insulin and the child came back to normal. We don't see this anymore because we've known about type 1 diabetes for a long time. Type 2 diabetes, okay, this is age-related. It happens later in life. You can have a genetic risk. So if it runs in your families, you're more likely to get it. Doesn't mean you're going to get it. All you need to do is maintain a healthy weight, okay, eat healthy, exercise, and that will put it at bay. It'll hold it off, okay? But the big epidemiology is people that are overweight. That's the huge one. Family history, like I talked about, and certain cultures are more likely to get it. Okay. So it says 1 in 4, so 1 in 20 for the other one. It's the very same types of symptomology right here. Okay. Um, it's going up, it's approaching 1 in 3 in our country with the obesity epidemic, okay? So how do we treat this? The best way to treat type 2, the age-related, is eating healthy, educating yourself about these practices, physical activity. There are lots of other drugs, Ozempic, which is all that, and drugs like that, okay? There's a whole slew of drugs other than insulin. Insulin is something that can be used as well, okay? If you've had this for a long time, maybe your pancreas is not making insulin as well anymore. That's a consequence of long-term type 2 diabetes. But there are many, many different types of drugs that are out there, drugs that are like Ozempic and Wegovy that affect how your pancreas works, help you to lose weight. There are drugs that will also help get rid of all the excess glucose in your kidneys. So there's a bunch of different strategies. We don't have time to go over to it today, but there are alternatives. Okay, so these are the risk factors: overweight, being sedentary, family history. Okay, certain ethnicities have higher risk factors. This shows you the prevalence based on culture, and the culture being, do you exercise? What kind of food do you eat? Okay, and we see right here that we watch this progression in the United States. This is what a person that studies populations does, public health officials, and you see that this part of the country is has far many more diabetics than in, say, the Western United States, and it has a lot to do with culture. Okay, so these are old numbers, 2010. We're now approaching more something like 50 million people. Okay, and it's a big burden. Okay, it causes kidney failure, it causes amputations, causes heart attacks, causes stroke. It's really a big deal. Okay, so prediabetes means that you're having trouble. Your blood glucose is diabetic at times, and it's really a shot over the bow that you need to get going and control your blood glucose, control your cholesterol, keep your heart disease at bay. Okay, very cool. All right, so that's what that's all about. That's a quick overview. Okay, this right here. Yeah, we encourage you to show some curiosity. It's a neat website. These are some figures from that website. We look at the number of people that have diabetes worldwide. It is a worldwide epidemic. It causes the most chronic disease. Remember we said the economic burden worldwide, globally, is these chronic, non-communicable diseases of aging. These are these very slow, insidious diseases that get worse and worse over a lifetime. Okay, so those are the numbers right here. Half a billion people, just really, really, really crazy. When we look at this and check it out, you can go into the United States right here and check out. We're at 1 in 4. Actually, the projection now, so we're going to be 1 in 3 because of the obesity epidemic. Pretty significant. What does it put you at risk for? Kind of went through this already, okay? So when we look at diabetes, it doubles the risk for heart disease in men, quadruples the risk for heart disease in women. It's linked to high blood pressure, high cholesterol, okay? Lack of activity, these are things that you can control. Heart attack, stroke, peripheral artery disease that results in amputations. These are all parts of diabetes. This is why if we can get the diabetes first, then maybe we'll do better on other things. We're going to talk later on about Alzheimer's disease. The biggest risk factor for Alzheimer's disease is being a diabetic, okay? It's because of the blood vessels and how they affect the brain and the inflammation in the brain, okay? ABC is a diabetes. Once you've been diagnosed, you check your blood glucose levels. This is a hemoglobin A1C. This is one of those glycation products that I was talking about. Quit smoking, okay? Take medicine, be active, eat more veggies and fruit. These are things under your control, okay? Super important. All righty. So these are crazy numbers. 40% of Americans are going to be diabetics, okay? This is many people are going to go blind from diabetes. That's a lot of people. This is a video that explains the mechanism of diabetes that I was talking about with the relationship to your pancreas, its release of insulin, and how insulin binds to receptors on muscle cells in the brain, fat cells, etc. And then if these receptors don't work right, what the consequences are. And this is, the one that is age-related, has a lot to do with, with lifestyle, what you eat. And then this is a great video of John. He talks about his complications and what are his complications. Okay, so this is going over this concept of how insulin works through the body when glucose comes up, and these are the complications I talked about. Okay, you can go blind. Okay, you can get Alzheimer's disease. You can have a stroke. Okay, heart disease where your heart fails. Okay, have a heart attack and die. Kidney failure. The neuropathy, the severe pain out in the periphery, and then associated with that then is infections that causes consequences of vascular disease, where you lose your limbs. Okay, no good, no good. So what can we do to fight this? Okay, what we can do to fight this is live a healthy life. It's the easiest and most difficult medicine. Okay, people are not compliant. You have it under your control. Eat well, exercise, try and reduce your stress. That's the goal. This explains why we do get obese. You can understand our ancestors from 1,000,000 years ago. We never knew when our next meal was going to come. So when we see food, we eat everything, and then you would have a fast for a week possibly, where there would be no food, and then you would gorge yourself, and then you would fast. Okay, so this is where we are set up. It's our biology. We're not that different from our ancestors from 500,000 years ago, 100,000 years ago, 1,000 years ago. We're about the same. Okay, so we see food, we're driven to eat it. Okay, certain foods are really high calorie. All right, and we're driven to eat those even more, sugars and fats and things like that. Okay, so you have to have this psychological control over how you eat. We fast forward to modern society. We have unlimited food all the time, and so what's the consequence of that? That means that we have to use our consciousness to stop eating, okay, which is going against our biology, and so people eat, and you get obese. Why did our body do that? Well, if you're looking way back, man, in caveman days, you would gorge yourself, okay, and then the food would be distributed to fat, and then you would go a week and a half with no food, and then you get to live off that fat for a while. How awesome is that, But we don't have that situation now. Okay, we just make fat and make fat and make fat. Okay, so one way the medical community looks at things is looking at your body mass index. This is a crappy index, okay, but it's super simple and easy, okay? But it doesn't account for how muscular you are, how large your bones are, okay? So people will look at the body mass index and of an athlete, and they would be unhealthy, so to speak, okay? And it's with the body, and so what we want you to do is to go in here and measure your BMI, okay? And there's an article about the BMI as a classic metric. It's how it's not great, but see how you stack up, and will you be considered healthy, okay? And from there, then we want you to go ahead and check out a couple other websites and check out your BMI and then post a discussion on it. Okay, my friends? All right, I'm going to say peace, another lecture down, and get in there, start thinking about your CT1.